Respectable viewers, today we are going to tell you about the chiropractic treatment of backache. Backache is a very severe back pain and really awkward pain while getting up from a sitting position, moving around, looking left and right. It always pains and makes you very uncomfortable. Uncomfortable in a way that you can't do anything, you can't do any job, you can't move around, you can't work, you can't go on your business. Even in case you go, then you will be uncomfortable. I just want to explain you the reasons why this backache starts and why this backache problem occurs and what is the treatment of the backache in a chiropractor way. Chiropractor gives immediate relief. Chiropractic treatments immediately solve the problem, and I just want to intimate you, to acquaint you with this treatment. We will just go around first with the reasons why this backache occurs. Let me first explain it to you. You can see on the chart there are three parts of the nervous system only. Brain being the head of the body. There is a spinal cord, right? Spinal cord, I will just explain the spinal cord. And the third part of the nervous system, as you can see on the chart, are spinal nerves. First, let's say, what is the job of the spinal cord? It takes all the sensory movements from all the senses of the body, let's say 5 senses you count in medical terminology, and then process it and pass it on to the brain. And brain process it, gives the orders, give the reaction that are to be passed through the backbone. That is, backbone is just called the lifeline of the body. There are 24 vertebrae starting from the brain, immediately after the brain, since it is the second part of the nervous system, brain being the first part. It starts from here where you can see my finger, and it is in few parts. I will just explain each one of them. The cervical spine contains 7 vertebrae starting between my both fingers. Both fingers, 7 vertebrae. And in between every 2 vertebrae, there are discs for giving the flexibility. Giving flexibility of movement. Giving flexibility for work, from where the spinal nerves also originate. Then there is a second part. Starting from here, this is thoracic spine and ending up here. That is thoracic spine having 12 vertebrae. Between every 2 vertebrae there is a disc. And the third part is this one. 5 lumbar spine vertebrae, each carrying a disc in between. Thereafter, there are some fixed vertebrae of the sacral and the coccyx. Right? Why this disc between every 2 vertebrae? Because these are the flexibility for movement, flexibility for looking left and right, moving neck left and right. What is their job? Why do we get the backache? We will just start it from the top. For the backache's sake, we will divide it in 3 parts. That is the upper back pain, middle back pain, and then the lower back pain. I will just explain each one of them separately to you. First, let's say, in case there is some subluxation here. Why do the subluxation occurs first? Bones are composed of 7 things: calcium, vitamin D, magnesium, phosphorus, silicon, copper, and fluoride, which we take from the diet. We eat all, let's say milk give us calcium, sun rays give us vitamin D, and similarly other diet give us various other parts of the bones, contents of the bones, which I have already mentioned. But mostly the vitamin D is in the morning and evening sun rays, that is ultraviolet rays. Few of the other contents of the body, let's say calcium, etc., are dependent on vitamin D for reaction to get absorbed. Until unless the reaction is there, those won't be absorbed in the body. As we age, or in certain cases where there is a deficiency, Nowadays, even people with very young age come to me with the same problem because they are deficient of vitamin D. And in case there is a deficiency of vitamin D, then the problem will occur. The spinal degenerative changes will start. And those changes, spinal degenerative changes, are in 3 phases. Initially, first one, second one, and then in old age, the 3rd phase. The problem starts when after the spinal degenerative changes, we change our posture. Let's say we are sitting not properly in the cushion, we are not standing up straight, we are having some jerks while in the movement, or we are traveling on patchy roads and tracks where there are jumps. In that case, since there is a weakness in the spinal cord, degenerative changes have already come, so there is a subluxation. Let's say, in case the subluxation is in the cervical area, starts from cervical and goes down to the thoracic. Let's say there is a subluxation in C6, then this area, this is shoulder blade, starts as you can see on the, as I indicate. Even there is a pain in the shoulder blade, and in few cases even frozen shoulder occurs. You can't lift the hand, you can't move the hand, you don't have any strength to move the hand because a nerve below the shoulder blade squeezes. Your upper back is tense. You can feel tendon, and if it is tense, then you'll have the pain in upper back, in shoulders, and in this area. In case there is a subluxation, because the subluxation is the root cause of the problem, because you are getting some pain. In case then subluxation occurs, let's say at a T6 area, thoracic 6 vertebrae, then you will get in the middle back area will be affected. And in case lower back area, lumbar area, that is starting from L1 to L5, there is a disc bulge, there is a disc protrusion, there is a disc herniation. Anywhere in the body, and especially in the lower back, then not only the lower part of the body will be affected, you will have pain in the lower back area, but it can also cause pain to radiate in the legs. It could be left sciatica, it could be right sciatica, or it could be bilateral sciatica. Beside the backache, you will also get pain in the legs, numbness in the legs, and in few cases, you will have the foot drop as well. The fingers of the foot will start numbness. You won't feel anything. You feel very tense. You will feel tense not only in the lower back, but also in the legs. So this backache treatment in chiropractor way is very easy. It's without surgery and without medicine. It is very comfortable in let's say in foreign countries. I may say Europe, America, etc. And some part of the Asia as well, like Japan, Malaysia, and Indonesia freshly adopted it. For every month people go to the chiropractor. Similarly, just for the reason that you take your card to the mechanic for tuning every month or after a fixed mileage, your body is also moving. Your body is also working. Your body is also running throughout the day. And once it is running, it is likely to get some subluxation because degenerative changes normally comes. If not otherwise, not because of the deficiency of certain chemicals, of course, due to aging process, it will definitely come. And in case subluxation is there is a protrusion of the disc, there is a damage in the disc or anywhere in the body, then you will start feeling the pain. In case of disc protrusion or disc bulge, then the immediate problem starts, and in case you go to the chiropractor, if the case is fresh one, it will just take one day, one adjustment, one session, and you will be okay. You will get immediate relief. But in case you prolong it, you ignore it, you keep moving, you keep working, and you don't, normally it happens that you don't get time for yourself, but you get time for everything else. And in case you ignore it, prolong it, then it will take more sessions. Now, my respectable viewers, I want you to stay with me and see the practical treatment of this backache. Be with me, please.